So I'm reminded of Margaret Mead saying, you know, never doubt that a small group of people can change the world because that's the only thing that ever has. So in a way, you're saying that if we want healthy communities, get involved.
Get involved.
And that you can actually affect something. Do you have an example of where people have got involved and actually done something within their local community that's helped to improve the health or improve resilience or got people ready for a disaster?
Well, down in Santa Barbara, they work alongside a local community event to assist with the homeless and walking through the community to make sure that everyone has the attention that they need. So they actually go to the people who are in need and have the health disparity, and they walk alongside and provide support for them and give them information about services that are available within the county. So the Medical Reserve Corps does that.
Well, bravo for Santa Barbara to pay attention. So they made the homeless a priority, and they coordinated programs to actually reach out. I think over here in Palo Alto, I remember my cousin was involved in a census of the homeless, and they went to all the creeks, and probably it was something like that. Now, is there a MRC unit in Palo Alto?
There is not an MRC unit in Palo Alto, but we are definitely looking to create one. Are you interested in creating a Medical Reserve Corps unit here in Palo Alto?
Oh, Jill, I thought you'd never ask. Actually, a group of us have got very interested in this. We've seen, you know, almost, it's been a slow-running disaster in healthcare where people are concerned about medical bankruptcies and what can we do to improve things. And here in Silicon Valley, we just feel like we're the ones who are able to help move towards the future and innovate towards that. So what we'd like to do is start here in Palo Alto, the California Health Initiative, which might take a look at how we ourselves, not medical professionals, not in health, but just normal people in the community, can provide a sense of forward momentum so that we can improve our community's health. And so you've been guiding us in how to move forward. What do you normally do for a group of people like us trying to start a Medical Reserve Corps unit?
Well, the great thing about the Medical Reserve Corps is that we are not all health professionals. So I am not personally a health professional, and a lot of the volunteers are not health professionals. And so for a new coming up Medical Reserve Corps unit potential, I like to talk to you about, well, what kind of initiatives are you interested in doing, and what kinds of people are you going to bring to the table? So tell me a little bit about some of the people who are coming to the table for the California Health Initiative.
Okay, so we've got Dennett Lewis. He's an award-winning film producer in this studio. So he produces a fitness program called High Five. He really cares about fitness and nutrition. In fact, I think the He brought these brownies to one of our meetings, and they were Paleolithic diet brownies, and it was making those brownies on the show that won him the award. So we've got people who are really, and Dennett works at Cisco, one of the high-tech companies. So you've got people in the high-tech companies who are also concerned about fitness and health and nutrition. So Dennett is co-chairing our FIT committee with Brian Champ, who runs boot camps and is a leader in fitness programs in the Bay Area.
Have you done anything so far? Have you reached out to any communities so far?
Well, we actually heard that San Carlos was running a wellness district, and so we, district festival, and so we as the California Health Corps are thinking, how can we participate? So a group of us made a field trip to the School of Public Health at UC Berkeley, and you came with us. That was so great.
That was a good trip. That was a good trip.
And so Linda Newhouser there told us about participatory health. And so we're looking to see how we can use these ideas of participatory health, because we kind of get a sense that we want to participate and improve our health. And what we're finding is being part of the California Health Initiative, we're able to actually pay more attention to my health, our own health. And I say my health because I know that if I'm reaching out for that extra brownie, I'm just not going to eat it because I think Dennett might think I shouldn't have that. And it's very helpful. I'm actually losing weight as being part of the California Health Corps. But talking about going back to local community, we like to see how we can get this participatory design so that it becomes what we do within the California Health Initiative. Those of us who've been in the technology area know that customer experience really depends on people being engaged. And you don't engage people by telling them what to do or what's good for them. They just like you said with Healthy People 2020, you have to have people care about their future and want to design what they want. And once they're involved in that way, then we believe within the California Health Initiative, when we can engage people in designing the future they want, the health they want, the communities they want, then we can all work together to something that we care about, and that's really worth all our efforts.
Yeah. The limited resource is public health professionals, and that's why we need people to step up, such as yourself and others within your community, to volunteer to assist in this type of participatory design. This ability to say, well, this is what we need. We have identified this as a need. This is where our health disparity is. This is where our health illiteracy is within our community, and this is how we can help. Because really, when you just identify problems and have real no solutions, then you're just overburdening the system versus coming up with a design and idea to assist.
Yeah, and I think there's several stages to that. So the problems can seem overwhelming. I think what we're saying is that, you know, we want to tackle things that seem overwhelming at the beginning. One of the first things we did in forming the California Health Initiative was to take a field trip to the Asian Health Services in Oakland. They're so inspiring. They really care about their community. And it was shocking to us when they talked about treating the victims of human sex trafficking. So many issues because the victims couldn't report to the police because they couldn't keep going. It was just terrible. And just to see the care and concern and compassion of the doctors who were desperate to help their patients, it pulled to our hearts. And, you know, many of us left thinking we have to do something. And so I think through something like the California Health Initiative, groups of concerned citizens can come together and start to tackle bigger problems like that over a period of time, not just try to throw money at the problem or say call 911. You know, these are complicated problems, and I think the California Health Initiative, we're hoping to interest more people, especially young people, in working on these community disparities. Especially here in Silicon Valley, we have so much. We have so much opportunity. We've got the best people in the world coming here. We should be able to do more to help those around us. So that's kind of what we're trying to do. What advice do you have for us?
Well, for anybody interested in starting a Medical Reserve Corps, it's really about narrowing it down to what your mission is going to be. Because having lots of big ideas is fantastic, but you really need to be able to express yourself as to what your mission is going to be and how you're going to support your community and how you're going to be involved in your community. Because the California Health Initiative right now is a group of people trying to discover that. They're trying to discover what their path is going to be to get more integrated into the local community, to really identify the need and be able to find the assistance and recruit more volunteers for your California Health Initiative as your work groups grow. So throughout the state and throughout the nation, we try and support the new development of Medical Reserve Corps based on the experience of the Medical Reserve Corps that already exist. So really, we have a peer-to-peer network that is unlike any other. We really support the sharing of knowledge and the sharing of trainings throughout the nation and for all new Medical Reserve Corps units. And then you get to meet people like me.